No more oral cancer. Oral cancer is a general term for malignant tumors that occur in the oral cavity. Most of them are squamous epithelial cell carcinomas, which are so-called mucosal mutations. In clinical practice, oral cancer includes gingival cancer, tongue cancer, soft and hard palate cancer, jaw cancer, floor of the mouth cancer, oropharyngeal cancer, salivary gland cancer, lip cancer, and maxillary sinus cancer, as well as cancers that occur in the skin and mucosa of the face. Oral cancer is one of the more common malignant tumors of the head and neck. Cause 1. Long-term addiction to tobacco and alcohol. Most oral cancer patients have a history of long-term smoking and drinking. Oral cancer is rare in non-smokers and non-drinkers. 2. Poor oral hygiene. Poor oral hygiene habits create conditions for bacteria or mold to breed and multiply in the oral cavity, which is conducive to the formation of nitrosamines and their precursors. In addition, due to stomatitis, some cells are in a proliferative state and are more sensitive to carcinogens. These various reasons may promote the occurrence of oral cancer. 3. Long-term irritation from foreign bodies. Tooth roots, sharp tooth tips, and inappropriate dentures can irritate the oral mucosa for a long time, causing chronic ulcers and even cancer. 4. Malnutrition. Vitamin A deficiency can cause oral mucosal epithelial thickening and hyperkeratosis, which are related to the occurrence of oral cancer. Demographic studies show that countries with low vitamin A intakes have higher rates of oral cancer. It is also believed to be related to insufficient intake of trace elements, such as low zinc content in food. Zinc is an indispensable element for the growth of animal tissues. Zinc deficiency may lead to mucosal epithelial damage and create favorable conditions for the occurrence of oral cancer. In addition, insufficient intake of total protein and animal protein may be related to oral cancer. 5. Leukoplakia and erythema of the mucosa. Leukoplakia and proliferative erythema of the oral mucosa are often precancerous lesions. 6. Related lesions. 1. The relationship between oral cancer and precancerous lesions. Many people have the experience of white ulcers or blisters on the inner side of the buccal mucosa. They often occur when there is stress, poor sleep, or changes in eating habits such as insufficient fruit. It will recover within a week. If it does not recover within 2 weeks, an examination must be performed to rule out the possibility of epithelial cell cancer. 2. Changes in the color of the oral mucosa. Normal epithelium is pink, and white or red polarized colors are abnormal. If it is red with white spots, it is a more serious condition. If there are dark red spots with white spots on the tip of the tongue, it is highly suspected of cancer. 3. Ulcers. Oral mucosal ulcers that have not healed for more than 2 weeks. 7. Long-term consumption of large amounts of betel nut. Chewing betel nut can cause oral ulcers, gum degeneration, submucosal fibrosis, and then lead to oral cancer. Medical research has found that chewing betel nut increases the risk of oral cancer by 8.4-9.9 times.